One. Today we are going to discuss very shortly about the ST elevation MI ECG changes. So, why ECG changes occur in ST elevation? In case of transmural infraction, the electrode is placed over the heart and the electrical current will go towards the epicardium or the surface myocardium. So there will be a positive deflection, but this positive deflection is going to hamper due to the myocardial infraction, so the baseline will be lower down and the respective ST segment will be elevated. This is relative elevation which will be shown in the ECG, which will be occurred after myocardial infarction. But when it is endocardial myocardial infarction, the current changes will be towards the endocardium because of the healthy myocardium present over the myocardium in infracted area. The respective changes in ECG will be the elevation of the baseline. So there will be relative depression of the ST segment. Similarly, if the epicardium is involved, then current flow will be present from the endocardium to epicardium, and then also the baseline will be same or baseline will be slightly downward. The ST elevation will be present. So the epicardial involvement or transmural environment will change as ST elevation, but endocardial environment will present as ST depression. But the ST elevation in case of epicardial involvement or epicarditis or pericarditis will be different from the transmural myocardial infarction. Because of this, the ST elevation will be concave upward in case of epicardial involvement or pericarditis, but ST elevation will be concave downward. This is looks like sad face. This is looks like happy face. So if you have myocardial infarction, this is very sad for you and your relative, and also for the doctors. And if you have happy face, then it is very good. Now we are going to discuss about the STT changes in case of myocardial infarction. The earliest change is within second is hyperacute T wave, and after that the changes will be ST elevation, which will be appeared in minutes to hour, and subsequently Q wave will appear after first few hours, and within 24 hours T inversion will be appear, and subsequent days and weeks ST segment will be normalized and T inversion will persist, and after months and years when the scar formation is permanent and no active destruction of myocardium, then T wave will also be normalized and T inversion will disappear, but Q wave will persist for whole life. Thank you very much, friends.